Hello! Together, we are MAGALDRATE. For my drug names, my generic name is MAGALDRATE. My brand names are Griupan, Losopan, Losium, and Mauson. Now this is my chemical name.
Talk about my drug classification. My therapeutic classification is antacids, meanwhile my pharmacologic classification is aluminum magnesium salt.
My pregnancy category is category C. It is not known whether I am harmful to an unborn baby. Before taking me, tell your doctor if you are pregnant or planning to become one.
Let's talk about my mechanism of action. I neutralize gastric acid, reducing the direct acid irritation effect. This increases gastric pH, which inactivates pepsin. I also enhance mucosal barrier's integrity and improve gastroesophageal sphincter tone. I also promote gastric mucosal defense mechanism and the secretion of mucose protective barrier against HCl bicarbonate, which helps buffer acidic properties of HCl and prostaglandins that prevent activation of proton pump.
For my pharmacokinetics, my route is through PO or per orem. My onset is 20 minutes. My peak is a note, and my duration is 20 to 180 minutes. My indications are hyperphosphatemia, magnesium deficiency, off-label GERD, gastric and duodenal ulcers, hiatal hernia, esophagitis, heartburn, and the acid indigestion.
Now let's talk about my contraindications. I am contraindicated in patients who have hypersensitivity to any of my components. I am also contraindicated in patients who have renal disease because it could lead to electrolyte disturbances if any absorbed antacid is neutralized properly. Also in MG-restricted diet, pregnancy and lactation, I am also contraindicated in GI obstruction. It could cause systemic absorption of the drugs and increase adverse effects. A big no-no in citrate salts, found in some calcium supplements, antacids, and laxatives. My adverse effects in the central nervous system are headache, confusion, and irritability. Meanwhile, in the gastrointestinal system, my adverse effects are severe stomach pain, cramps, bloating, nausea or vomiting, ongoing loss of appetite, weight loss, severe constipation, and diarrhea. In the genitourinary system, painful or difficult urination. In the musculoskeletal system, bone pain or muscle weakness, and joint pain. My other adverse effects are mood changes, swelling hands or feet, and hypersensitivity reactions to MAGALDRATE.
So here are the nursing responsibilities before administering me. First is to consider important safety indications to prevent complications. Second, confirm the order. Check the patient's most recent lab results, including her CBC or complete blood count and platelet count. Check her medication administration record for previous dose and site. Next is to assess for possible contraindications and cautions, like any history to prevent hypersensitivity reactions, renal dysfunction, which might interfere with the drug's excretion, electrolyte disturbances, which could be exacerbated by the effects of the drug, and the current status of pregnancy or lactation due to possible effects on the fetus or to the newborn. Next is to perform a physical examination to establish baseline data. Next is to inspect the abdomen, auscultate bowel sounds to ensure GI motility. Next is to assess mucous membrane to evaluate potential problems with absorption and hydration. And lastly, monitor laboratory test results. And lastly, monitor laboratory results including serum electrolyte levels and renal function tests to monitor for adverse effects of the drug and potential alterations in the excretion that may necessitate dose adjustments.
Now let's talk about the nurse's responsibility during drug administration. First one is adequate drug absorption. You should administer me apart from any other oral medications approximately 1 hour before or 2 hours after to ensure adequate absorption of the other medication. Is ensure therapeutic levels. Have the patient chew tablets thoroughly and follow with water to ensure the therapeutic levels reach the stomach to decrease acidity.
The next is prevent imbalances. Assess the patient for any signs of acid-base or electrolyte imbalances to ensure early detection and prompt interventions.
You should also institute a bowel program. Monitor the patient for diarrhea or constipation to institute a bowel program before severe effects occur. It is also important for the nurse to ensure the adequate nutritional status of the patient. Monitor the patient's nutritional status if diarrhea is severe or constipation leads to decreased food intake to ensure adequate fluid and nutritional intake to promote healing and GI stability. It is also important to provide patient support. Offer support and encouragement to help the patient cope with the disease and the drug regimen. The nurse should also educate the patient. Provide thorough patient teaching, including the drug name and prescribed dose, schedule for administration, signs and symptoms of adverse effects, and measures to prevent or minimize them. Warning signs that may indicate possible problems and the need to notify the healthcare provider immediately. It is also important to perform diagnostic testing. Obtain specimens for periodic monitoring of serum electrolytes to evaluate drug effects.
After administering me, these are now the nurse's responsibilities towards its patient. First is to monitor patient response to the drug. Second, monitor for adverse effects. Third is to evaluate the effectiveness of the teaching plan. And lastly, to monitor the effectiveness of comfort measures and compliance with the regimen.